For crying out loud, let's talk about children exposed to alcohol. And why would I use the expression for crying out loud when I'm supposed to talk about children exposed to alcohol? Because they do cry a lot. And although the phenotypes or expression of alcohol exposures and its consequences are highly variable, nonetheless, these children also share recognizable faces. Their behavior as they grow changes. At a later date, instead of crying a lot, they tend to show some distemper, some disharmonious character, often may become antisocial or even criminal. The most appropriate term of the effects of alcohol on children is to label the consequences as alcohol embryopathy. This then implies a very broad range of mostly functional alterations, of which only a minority we can detect by alteration of structures. If these alterations are not very intercorrelated, some have alterations of growth, others dysmorphogenesis, and so forth, one most constant is the neurobehavioral functional alteration. We can detect growth alterations, that's the next most constant, virtually constant. We can measure height, weight, head circumference, and if diminished, we'll call it microcephaly. And we can look at the morphogenesis and say, well, there are distortions, and they are mostly perceived in the face. If these connections are not very consistent and vary from patient to patient, we could call it spectrum. So here is the other term, fetal alcohol spectrum disorders. If these alterations are tightly intercorrelated, we say the patient has a syndrome, and we then dare to call it a diagnosis. In fact, there is more that we don't know that we do know. So here we are going to talk about pathogenesis, that is, how does alcohol exposure alter pathways of development. This is the third of four webinars dedicated to alcohol. Pathogenesis, in essence, means how do we suffer from something. Pathos is abnormal, is suffering, pathetic. And it is focused on the mechanism of translation of a cause into a manifestation, functional or structural. And as we already stated, fetal alcohol syndrome, fetal alcohol spectrum disorder are one way to say that the phenotypes are very variable, therefore the pathogenesis is very complex. And this variability is that many signs are dynamic, many will emerge with time, some will vanish, and the array of anomalies in the prenatal period or in the infancy or in the adult may be quite different. So there is no known single principal, main, or central pathogenesis that results in the main effect or alterations of embryogenesis due to alcohol. On the other hand, we know many disruptions by alcohol of the embryogenesis process, many alterations of developmental mechanisms, but none is predominant. So what do we know? We know that before conception, the alcohol has impacts on the gonads. For instance, on the quality of sperm, on the viability of eggs, therefore on fertility. A complex area indeed. We also know that during early embryogenesis, alcohol eliminates many embryos, that is teratothanasia. The percent of eliminated conceptions decreases as the pregnancy goes on, and this is indicated by the thickness of these arrows. And we know that as the pregnancy progresses, the fetus has survived the elimination and is developing the best way it can, but many perish on the way, and finally the birth occurs and the child may or may not be more or less severely distorted. So one perspective of looking at pathogenesis and the mechanisms of alcohol that alter embryogenesis is to think of when did it start? What are the signs which we described in the previous webinar? In this case, the causes is alcohol, but there are many correlated causes, for instance, nutrition, the question of sensitivity repair, which tissues are impacted, which of those tissues can repair or not repair, and not repair may imply a lethal situation. And how does it evolve? How does it change as time occurs, growth continues, and this growth is somewhat deformed, altered, or deviated? We know that among the tissues that are most sensitive is the brain, and that it can be damaged by alcohol as well as by radiation. So therefore, one cause and a different cause can impact the same pathogenesis, and therefore manifest by similar effects. Take, for instance, microcephaly. Alcohol and ionizing radiation may share the impact on a pathogenesis of microcephaly. So it is important to realize the interrelationships of etiologies with a reduced number of pathogenic mechanisms, or vice versa. One etiology can impact many pathways of development. We should remember that the brain continues developing during and after birth of a child, which then results in change of the spectrum of anomalies. We also should keep in mind that alcohol should be avoided not only during pregnancy, but throughout the development of an individual. Minors, that is, children, have to be protected from alcohol just as much as the embryos. Besides sensitivity, we also know that it's important to know how much alcohol was consumed. How fast was it consumed? How often or consistently it is consumed? And here is an approximate way of comparing one patient with another, one population with another, one alcoholic event with another. Here is a relative content of alcohol in beer, in wine, or in hard liquors. And then these are the sort of artificially constructed equivalents to one drink. We also need to know the company. How is the alcohol consumed? Here are teenagers trying to drink as much as possible, as fast as possible, to get drunk as much as possible. And here is a social group of women consuming alcohol, smoking, and engaging in unhealthy behaviors. One encourages the other. It tends to create addiction. Matrimonies, couples, may also drink what's called closet drinking, and here you have then a situation for additional consumption of drugs, etc. And the question is, can they raise a child, even if they have one? Is the alcohol consumed purely or in the context of many other teratogens, such as marijuana, alkaloids of some sort, smoking, heroin? Is the alcoholic parent feeding the baby with breast milk that contains alcohol? And what is the dose? We said how much, but how much does it reach the embryo or the fetus? How do you calculate that? If these triangles represent the same dose of alcohol and the base represents how quickly it was consumed, obviously the peak dose on this triangle is much higher than the peak dose in this one. The amount consumed is the same, but the peak dose is different. So binge drinking, consuming a lot of alcohol quickly, like the teenagers like to do, results in one of the worst risks for the embryo, which is a very high, quick rising peak dose. So we spoke of sensitivity. The earlier the pregnancy, the greater the sensitivity. The earlier the pregnancy, the more regeneration of the cell damage is possible. The longer the pregnancy goes on, sensitivity decreases, but so does regeneration, and repair decreases as well. All of this has an impact on selection. How many are dying? How many are dying? How many are dying? And even among survivals, the mortality is high. So remember, alcohol kills. I repeat, alcohol kills. So you need to take into account this dynamic process of development, and you need to take into account that the manifestations at different stages are somewhat different. One thing that is of importance to remember is that alcohol is not a carcinogen, that it causes more functional than structural defects, that the genome is a plan, a child is the result, and the process is development, and if altered, it is that pathogenesis, or what we call embryopathy, phytopathy. Alcohol can come in different doses at different times, singly or repeatedly. So we said how fast, how much, how often. And the epigenetic factors, nutrition, age, and so forth, modulate the translation of the cause into an effect. And we already said that behavior is the main manifestations, later deficits of learning, and including structural anomalies. All of these were presented in the previous webinar. Let me come back to this, because the epigenetic modulation of the effects of alcohol or radiation are almost of more importance than the genome itself. So as the alcohol impacts during, let's say, embryology, during the embryogenesis, the epigenetic factors enhance or decrease its effects. If they enhance it, that means sensitivity. If they decrease it, that means resistance. And here you have the result. And you should measure, as we stated in the previous seminar dedicated to semiology, to make sure that this child doesn't have microcephaly. And here is then an adhesive little piece of paper that has a diameter of a known number of millimeters, which allows you to measure distances and making a more accurate observation. So why to show this orchestra? Well, the orchestra is perfect, and the music is perfect, and the composer was perfect, and the genome is perfect, but the director is drunk. If he starts the symphony being drunk, maybe this part of the orchestra will play badly. But if he becomes drunk later, maybe this component of the orchestra will play badly. Or this one, or this group of cello players. We could see that they are somewhat related, interrelated, because they all are one symphony playing one composition. But these are closely correlated. Let's say they all have to do something with the face. They all play the same melody, which is different from this one or that one or this one. And you could see that in essence, to understand the pathogenesis of alcohol, you should understand the symphony. And if you understand the symphony, you understand the whole sphere of embryogenesis and phytogenesis. What I just said is represented here in a different way, in a graphic way. Here you have a cause, alcohol. Here you have another cause, radiation. Alcohol is a teratogen, so is the radiation. Teratogens cause malformations. Teratogens kill, so they can be lethal. Or they can delay growth, called intrauterine growth retardation. This is part of a package. Radiation does it, and alcohol does it. The malformations may have a recognizable pattern: fetal alcohol spectrum disorder. Radiation causes a different pattern, and after birth, it results in leukemia, cancer, neoplasia. Therefore, radiation is a mutagen. It changes genes and chromosomes. It causes genetic disorders. It is a carcinogen. But alcohol is not. So yes, both are teratogens, but alcohol is not a carcinogen. Radiation is a teratogen and is a carcinogen. What we see is then that they share the manifestation of developmental anomalies, some of which are identical regardless if it is radiation or alcohol, because they have the same pathogenesis. So here is a beauty. Wonderful face. But it was developed from parts that converge, that blend. Left and right midline. Right side of the upper lip, left side of the upper lip, and two limits and a groove we already know is called philtrum. This is the edge or the extent of the oral opening, and we know that this is a valley, the confluence of the maxilla with the nasal process. Here is the mandibular process, and this then extends all the way to the opening of the external ear canal, and that's closed by now. And how is that in these areas there are alterations? What kind of alterations? Grooves, fissures, clefts, fistulas, hernias, coeles, that is tumors, and so forth. So malformations don't occur anywhere, they occur in specific points, points of confluence, points of development. So there must be a mechanism, a pathogenesis, why these locations are prone to have any number of these sorts of problems: cyclopia, synophthalmia, hypothyroidism, encephalocele, hyperthyroidism, nose duplications, proboscis, a genesis of the central upper lip, and so forth and so forth. So what's the mechanism? The mechanism is embryogenesis, is a embryo pathology. And here is a fuller schematic representation. There are two ocular vesicles. They tend to converge, and they do not fuse to create one eye, but we are left with two because the frontal process descends from the frontal lobe all the way to the end of the edge of the upper lip. And this is where that groove occurs. The maxilla are two lateral processes that converge toward the nasal prominence, and the mandible does the same, and in between is where there is going to be left the oral opening. The ears develop in the neck, and they are virtually horizontal below the mandible, and they rise and rotate to take their position somewhere here and become having a major axis, so we could say they are partially malrotated, and they represent the fusion of many parts of the maxilla, the mandible, and the hyoid bone, which then converges under the mandible. Here is another representation, but this one is based on scanning electron microscopy, and you could see then the components just mentioned: the frontal lobe, the midline, the frontonasal process, and you can read these slides, stop the motion, and I hope you will enjoy it what follows. So take a good look so that you can remember these points. This is the basis why all our faces are different and we use them to recognize each other. But this is also applicable to clinical medicine. On the left, you see a facies suggestive of fetal alcohol syndrome. Here are the signs. So narrow pupillar fissures, short nose, long flat upper lip, relatively small flat border of the upper lip with no cupid bow. And on the right you see two embryos of mice, one exposed and one unexposed to alcohol. Here is the same with some labeling distinguishing this facies and comparing them with these facies of experimental animals. This is then further emphasized in the images on the left. It is obvious that there are contrasts between A and B, or between A and E. So next you're going to see a video. Please enjoy it. It is a wonderful production by colleagues who have belabored to make this very didactic motion of embryogenesis. This is then the frontal view and the lateral view of the development of the face. The frontonasal zone, that's the most important damage where we can detect related to alcohol exposure. So please pay attention of how the frontal lobe impacts the development of the face and the upper lip, the face and the upper lip. And enjoy the video, stop it anytime, view it many times, and we'll continue thereafter. So welcome back. I hope you enjoyed the video and grasp better the importance of the face in the understanding of alcohol embryopathy. As stated, there is no central pathogenesis that we know of. There are many mechanisms that are altered by alcohol, and they are alterations that are direct and indirect. Therefore, the prevention and treatment of alcohol embryopathy is likewise direct and indirect. And alcoholism and intoxication by alcohol are separate subjects that we did not touch upon in this presentation. So let's go back to binge drinking. Binge drinking often is an asymmetric drinking. He drinks less and tries to get her drunk. The consequences are likewise asymmetric. She may become pregnant for a day, but her offspring, and she may know that she's pregnant or she may be getting pregnant, the consequences for the offspring, this little fellow here, is drunk for life. So the consequences are likewise asymmetric. It's a terrible situation that is becoming worse and worse in modern societies. And Kiev and Ukraine are not exempt. It's absolutely amazing to see the young generation of immature brains that are still under development roaming the streets with bottles of beer trying to get drunk, binge drinking. They are damaging two brains, the incomplete development of the brain of a teenager with the developing brain of an embryo. It is truly a social tragedy. The peak doses of participating in such quote-unquote celebration cannot be overemphasized. And here we have another aspect. Once the child is born, the neurodevelopment deficit may be present, but the neurodevelopment continues, and alternative channels of compensation could be developed if the fetal alcohol syndrome or the fetal alcohol spectrum disorders are recognized on time. Here are the priorities of the National Institute on Alcohol Abuse. Here is its director at the time, and there is a special presentation by him that was included in the prior webinar. So please see it again if you need to refresh your memory. And in the next webinar, we are also going to address the amelioration and treatment, including neurodevelopmental deficits, because the early recognition of children damaged by alcohol gives them a chance to benefit from remedial intervention and therefore limit the consequences of their brain limitations. So remember that prevention can be direct, removal of alcohol or the cause, but it also can be indirect, and that is amelioration. So now we have reached the end. Thank you for your attention, and I hope that you visit us again soon.